Hi, my name is Ellen Clifford. I am a disabled activist. I've worked in the disability sector for about 25 years now, or coming up to, and I am author of The War on Disabled People, which was published in June 2020 and won the 2021 prize, Bread and Roses Prize for Radical Publishing. I have been asked for Disability History Month to give my analysis of Tory attacks on disabled people, as well as what we can all do to protect our health and well-being. So in terms of my analysis of the Tory attacks, that is basically the subject of my book. So I'm going to attempt to give a summary. I think in the book I identified three key factors within what I believe are the ideologically motivated attacks by Tory-led governments on disabled people. The first one, I would say, is linked to austerity, which was about trying to make the poorest and most disadvantaged in society pay for the financial crisis of 2008, a crisis that was not our fault. And the impact on that as regards disabled people was about reducing the social security budget, which meant attacks on our benefits, but also, of course, attacks on all the other services that disabled people use. We are disproportionately reliant on public services because of the system that we live under, whereby people need to earn a wage within a competitive and often discriminatory workplace. It was very clear from when the coalition government first came into power that disabled people were going to be disproportionately impacted by austerity and welfare reform. George Osborne, in his first ever budget as Chancellor of the Exchequer, said that disability living allowance, DLA, would be replaced by personal independence payment, PIP, and the aim of that was to reduce the budget for that particular benefit by 20%. There was also a cumulative impact for disabled people in terms of the combined impacts of the attacks to our social security payments, along with the cuts to the services that we receive, not just social care support, but of course, all frontline support, community organisations that we use, funding for deaf and disabled people's organisations, the massive attacks on the education system and provision of learning support so that disabled pupils have the chance to learn in mainstream environments. Second factor, I'd say, was privatisation. So wanting to dismantle the social security system and give it over to the private sector to run. That was a particular vision that someone called Lord Freud had. He actually crossed the floor after the Labour government lost the election, crossed the floor to the Conservatives so that he could carry out putting that vision into practice. Actually, his vision never materialized. I think the toxic reputation that many of the private companies that delivered the benefit assessments gained as a result of operating those systems that pushed so many disabled people into poverty, led to people killing themselves and losing their lives because of removal of essential support, meant that very few companies were then prepared to want to get into that. The third factor I identified was linked very much to the Conservative economic agenda, which was about making sure that businesses were propped up after the 2008 financial crisis. There has been, ever since then, a period of low productivity growth. The austerity regime was a way of approaching this so that businesses could continue to maintain their profits by squeezing workers. So a lot of the changes in approach that were brought in through the welfare reform agenda and which were embedded within the introduction of universal credit, so things like ramping up of sanctions, conditionality, 35-hour a week job searches, were about making it so unbearable to be on out of work benefits that people will be prepared to take, the worst job under the worst conditions. Bringing in those kind of approaches was also about preparing unemployed workers for jobs where what we're seeing trends in the modern workplace are decreasing autonomy, decreasing ability for workers to look after their own health and well-being, and increased stress and intensification of labour. So trying to make the social security system mirror those downward worsening trends within paid employment within the workplace. And of course, those all had a discriminatory impact on disabled claimants, but the government, the Tories, really didn't care, because for them, business and the profit motive is much bigger priority for them than our well-being. Is a level of maybe incompetence, lack of understanding of who disabled people are. We were, before the pandemic, we made up 68% of the benefit caseload, yet universal credit was designed to be digital by default. It was designed in a way that makes it very inaccessible to many disabled people. I think that was partly an accident, just because we are always a side issue, even when, as in the case with benefits, we're actually the majority of the caseload. I think there is an attitude of direct hostility towards disabled people in some quarters of the Tory party as well. For some, they do have albeit paternalistic approach, but do not like the idea of actively harming disabled people. But I think, as we saw particularly under Boris Johnson administration, there is a current of eugenics thought that still runs within the Tory party. Finally, what can we do about protecting our health and well-being, particularly as we're in danger of austerity Mark II with the new Prime Minister coming in? This is really, really important. And I would say, in my experience as a disabled person, it is our peer support networks that play a vitally important role in our lives. It's where we share information about how to survive. We are able to share resources. We're able to keep each other going. The other thing, I think, is actually getting involved in campaigning. I've been involved in 2 different projects run by the University of Essex, and findings that we didn't aim to uncover, that came out as a byproduct of the research, were that an attitude of resistance can actually help disabled people to maintain a sense of positive identity during the worst times of cuts, when you're up against a perverse and literally mad-making social security system. It can give us a sense of empowerment that can make us want to keep going. The kind of that anger is much better to experience than a feeling that you just want to give up. But it also puts you in contact with other people, and it is social networks which are really, really important to the well-being of many of us. However you want that to be, whether that's online or in person, trying to find those networks that communicate in ways that are accessible to you. I think that's really, really important.